Hello, everyone, and welcome to the fifth episode of Empower Her Voices series. This podcast is meant to actually share insights, perspective, and stories which revolve around empowering and educating women and young girls. And we are really glad and honored to have our esteemed guest, Dr. Deepak Puri, for today's episode, which is going to be about understanding the myths, importance, and different other important information regarding heart health. And Dr. Puri is the Senior Director of Cardiovascular and Thoracic Surgery at Max Super Specialty Hospital. He is an expert in complex cardiac and thoracic surgeries. Dr. Puri is also a renowned international academic leader in clinical research, and he's a global chairman at Cardiomergen as well, which is a global trust. So we would like to welcome Dr. Puri that he took time out from his busy schedule, and today he's going to educate us about the heart health.
Good morning, everyone.
Welcome. Thank you, Dr. Puri. Thank you so much for accepting the invitation. It's really kind of you. And we're really excited for today's episode because it's really, really, really important, and nothing's more important than health. So, before that, we are going to start. I would really like you to walk us through your journey of where you are till now. So, we would like to know it from your side, sir.
Thank you so much, Faiza, for inviting me. So, I'll briefly tell you about myself that I belong to Shimla, which was the capital of India in British regimes during summers. And also, after doing my medical school from Shimla, I came to Chandigarh, which is a very beautiful city in the north of India. And I did my MS in surgery from there, and thereafter I did my MCH in cardiovascular and thoracic surgery. And later on, I joined as assistant professor in the faculty of PGIMER, which is a very prestigious institution in India, and it is well known abroad also. Thereafter, when the corporate sector came up, so there was a lot of advancement in the management of cardiovascular diseases in the corporate sector. So I joined Fortis Hospital Mohali, which was the first Fortis hospital, and they have a chain of more than 80 hospitals all over India. I worked there for around 13 years, and after that, then I joined as a senior director in Max Hospital Mohali, where I'm working right now. So I had a good fortune of visiting some prestigious institutions in US, like the University of Maryland in Baltimore, and the Swedish Hospital in Seattle, Washington, and also the Leipzig Heart Center in Germany, which is a very one of the largest centers of cardiovascular diseases management in Europe. And apart from that, I had the good pleasure of visiting Lahore, and that was in 2006 when there was a heart summit, and I was invited to give two talks and two chair sessions.
Great.
And I'm very thankful to the hospitality that was offered. I still remember, and recently also participated online in one of the heart failure conferences that was organized in Pakistan. And Dr. Shahbaz, like he's one person who is in close contact with me, and we interact with each other for academic events.
Great.
I'll like to add another thing that after working day and night for managing, I'm basically a surgeon, so we do a lot of cardiac surgeries, and the main cardiac surgery that we do is bypass surgery, CABG, and we do it off pump. Since last 20 years, we have been doing all the surgeries off pump, and we realize that however number of surgeries we do, but still we cannot control cardiovascular diseases, because now this Indian subcontinent harboring heart failure and heart disease patients, almost 60% of the world's population of heart patients, they reside in Indian subcontinent. So we realized this, and we thought that 80% of the heart disease, they are preventable. So people are not taking appropriate steps because of lack of awareness about how to prevent heart disease and how to manage. Like, people don't know when to go immediately to the hospital after a heart attack. They waste time, and then the heart muscle is damaged, and they later on become heart failure patients. So, to educate people about the prevention as well as the interventions and the latest development in technology, like new technologies are coming every few years. So, we keep updating people around the globe, and we organize workshops and conferences across the globe to make people aware. And especially we focus on the youngsters, because uh, in India, young people are dying because of heart attacks suddenly, especially after COVID. So I'm not really aware of what is the situation in Pakistan, but I'm sure that genetically we have the highest risk among all races, and which
True.
is almost 20 times more than the Japanese, and 6 times more than Chinese, and 4 times more than Americans. So we must take care and protect our hearts.
Absolutely, Dr. Deepak, thank you so much. Your journey is truly inspiring, and the way you have actually given the, shared the importance of what heart disease and heart health is.